And we have Dr. Rakhi, who after doing residency from LVPI Bhubaneswar has taken up this challenge of going into private practice. So let's hear her perspective first. Why did she choose and what opportunities or difficulties she is facing, and then we'll discuss on that.
Okay, right. Absolutely perfect.
Good morning, everyone. So first of all, I would like to thank the organizers for giving me this opportunity to present in this platform. So my topic has familiar situations where each one of us will face during the initial part of our career. So I'll be presenting on a leap into private practice soon after your fellowship bar residency. So as discussed by the earlier speaker, there are so many options we have soon after our residency. But I would say it's always better to pursue a fellowship if you have time and you have support from your family. Because this will fill the knowledge gaps of residency and this will boost your confidence, especially your clinical as well as your surgical skills. But before choosing a subspecialty, you should have genuine interest in the subspecialty you are choosing. And also look for the demand and scope of that subspecialty in your hometown, whether it is professionally saturated in your hometown or not. Mind you, it is time consuming. But by the time most of us reach the fellowship, we'll be around 28 to 30s. Then there'll be pressure on you from your in-laws, from your husband, relatives, saying, "Arey, it's time to get married. Bacha nahi hua." And all those things, also saas bahu natak will go on. On the other hand, we have the financial burden also if you don't have a supportive family. Finally, many of us will have to give up. And we give up on further training and then go on into job, looking for job. So when you're planning to take a direct leap into the private practice, there are two options. One is joining an already established private institute, and second is setting up your own private practice. So before deciding in between these two options, I would say, first ask yourself, what do you want to see yourself in 10 years? Whether you want a completely peaceful life or you can handle some stress also. How strong is your heart? How brave is your mind? And how healthy is your body? Because there'll be situations in private practice where you have to manage all your complications by yourself, where you have to handle irritant patients and bystanders, where you'll have to suffer huge financial losses initially. So, if you want a little bit of peaceful life, I would say join a private institute. But anyways, again, when you are looking for a job, like in my case, when I start looking for a job, soon after my residency, they said, "You're just ex-resident, how can we hire you? You don't have a fellowship, no jobs for you." Most of the places said so. But I think, on the other hand, few of my friends who have done their fellowship, just after their fellowship, when they started looking for job also, they said, "अरे तू तो fresher है, कितने साल के experience है, नहीं हम लोग नहीं ले सकते." So anyways, फिर भी dramas तो चलेगा ही. But finally, if you're successful enough to get into private practice in an institute, I would say there are certain advantages. Like this one is already established in the town, so you can get to see and learn how a successful practice works. There is adequate volume of patients, so number of cases and further training is assured. You don't have to give any investments, but you have a fixed monthly income. And if you're supportive seniors, like your professional growth is assured. You can collaborate with other subspecialties also for surgeries as well as for research purpose also. And as cataract surgeons, as we all know, we need a VR support to have a peaceful life. So this is also ensured in an institute. Disadvantage is that you are just an employee. You have a boss. You have your own targets. Your timings are inflexible. You're just one among the many consultants. Not all patients are coming for you. You need to put that extra effort for peer recognition as well as for making up your own identity. Next step is a solo private practice. So, advantage is that you can be your own boss, bindas, absolute freedom to how to practice. You can schedule your own timing, no ceiling to your earning once you become successful. Mind you, this is a very challenging situation. It takes time, extra effort, but yet it is rewarding in the final. Disadvantage is that you need proper planning, you need financial support from your family, you need to take huge bank loans, You can just be a comprehensive ophthalmologist in the initial period. You can just say that I have done subspecialty, like fellowship in this subspecialty, I can practice only that. You cannot say that. You have to be comprehensive. There are stress and tensions of failures, and it takes time. Next is where to start. I would say smaller towns are the best potential markets because they are less likely to get saturated and they give good returns and less time to become popular also. But wherever be the location, it should be an easily approachable location with ample space for your OT, your working, your waiting area, parking, and there should be space for further expansion also. And before choosing, you have to think of your family also. Your spouse job, your children's education, their willingness to relocate, all these things matters. And before starting, I would say you need an initial referral base. For that, you have to go and visit the local practitioners in that area, all the local physicians, and also you need to go and attend the local body meetings to explore the market. Start at a smaller scale, but scale up fast. And while buying instruments and other things, do not compromise on the surgical results and safety at any cost. Recruit wisely. You need 1 to 2 trained staff and few multitaskers also. And initially, you will have to take your time to train as well as to supervise everything. Get to know your patient. Take your time to get to know your patient. Your 1 minute more of inquiring about their personal life or mental health creates that magic of patient-doctor bond. And mouth publicity works like wonders in rural areas. Social media is yet another powerful tool. So you have to build your online presence for you as well as for your institute in your social media, because in this era is runs by social media advertisement only. So to conclude, you need to create your own timeline. Where you want to do your residency, where you want to do your fellowship. And once you kick start into the fellowship or residency, work hard with effective good management. You have to get the maximum out of your residency and fellowship. And then set your life, your professional as well as family goals. Create your own timeline based on your interests, kickstart. Be a hard worker among all the other peers and be compassionate. You should have a very good attitude towards the patient. This will make you stand out. Keep upgrading and updating yourself. Be humble and eager to learn. Then you'll be successful.
Thank you, Rakhi. Rakhi has covered the topic well, in spite of the fact that she has joined an organization called Alia Eye Hospital Trivandrum, but she has covered topics like why should somebody join into a private practice after initial training. Of course, here you do not mean that immediately after your post-graduation program. It is basically depending on your need. If you want a fellowship program, complete it and go into a practice. There are a lot of plus points that, as you said, that you should have a good training. You should have a area of your practice properly thought of. You know, you cannot just jump into practice anywhere with a lot of competition. Second, you must have a financial backup. You must plan your timings, that how you are going to achieve your goal. The advantages is that you have a satisfaction that you are doing your own thing at your own will, and you are the boss. And of course, finance. I being a practitioner, I know that I do earn much more than what I would have ever thought in a job somewhere or in an institutional practice or a NGO practice. So obviously, finance is not a problem if you cross over the initial 5 to 6 years. So thank you, Rakhi.